Hi there, my name is Dr. Ali Miller, and I'm a family chiropractor with a special interest in prenatal and pediatric chiropractic. And I am super excited to be sharing with all of you wonderful mamas a little bit about developmental milestones in your infants and young children. Now, essentially, developmental milestones are significant physical and behavioral signs or markers of optimal development in your infant and young child. So things like holding their head up, tummy time, sitting up, crawling, walking, talking. These are all of the milestones that we are very familiar with. Now, additionally, it's also important to look at some of our internal development as well. Things like sleep, immune function, digestion. Those also provide valuable clues on how your child is progressing. Some of those milestones are often overlooked, but they actually will provide clues as to why developmental delays are happening in your child in the first place. Now, I have always found it easier to talk about developmental milestones not only in stages of a baby and toddler's life, but also in different categories, because a lot of these categories are also happening at the same time, and we want to make sure that a baby is going through milestones in all of the different categories. So that first category is that motor category. This is the one we're all familiar with. So, initially it's that baby learning to hold their head up or having some neck control. As they get a little bit bigger, it's being able to have tummy time, to push themselves up, to move their head around. It's rolling over, sitting up, crawling, standing, walking, running, jumping, and the list goes on. The next category would be that social category. So this is your baby being able to make eye contact or smile. As they get a little bit older, it's laughing and engaging, interacting, even initiating play on their own. The next category is going to be the cognitive category. So this is the thinking and reasoning, problem solving, understanding, decision making. The next category was going to be that behavioral and emotional. So again, this is as they get a little bit older, this is going to be your child being able to learn or calm themselves, self-regulation, patience, listening, following directions. This is a big one as we go through those toddler years of making sure that our child is kind of ticking those boxes. The next category would be the digestive category. So again, this starts right from infancy with a baby being able to latch and swallow. So key pieces of breastfeeding if you're going that route. This is also going to address a baby's motility as they're consuming milk or formula and then food. We want to make sure it's moving through their system with ease. And that, of course, turns into being able to have bowel movement. So constipation, pooping. We want babies pooping. The next category would be immune function. So again, this is as your baby gets a little bit bigger, handling a fever, coughing, being able to clear congestion, handling teething as they're an infant or seasonal changes, being able to get over a cold quickly as they get a little bit older. Those are all immune function developmental stages that we want to go through. Now, it's easy, to kind of tick those motor ones off or to know those, but it's important to look at all of these categories because oftentimes some of these stages where things are not functioning properly are easily dismissed. So we see things like, colic or reflux or constipation in a baby that is easily dismissed or, moms are told, oh, don't worry, they're going to grow out of it. But in fact, those are important processes that your baby does need to go through because they often do not grow out of it. It just turns into something else. And maybe that becomes, emotional dysregulation or a sensory processing disorder. And we obviously don't want that for your baby. We want your baby and your child to go through all of these stages with ease so that they continue thriving and being happy and healthy. Now that we talked about all those different categories, I want you to think about it almost like a triangle, that you have to kind of start with your bottom level or your basics of milestones that we want to hit. Once we've kind of hit those, we can move to that next level. And once we can hit those, then we move to that top of the triangle for the more elaborate functions. So that level one or that part one are the basics. This is a baby being able to eat and poop. This is a baby being able to sleep and soothe themselves, and this is a baby developing that respiratory and immune function. Once a baby has nailed all of these things with ease, now they can kind of start to hit those milestones that are next up. So that's going to be the movement and motor milestones. So again, this is a lot of that head and neck control. This is their upper torso functioning well, so that tummy time with ease. This is the rolling and the sitting, the crawling and the walking. Those are going to be that next chunk. But remember, we have to hit that first chunk easily and hit all of them so that we can go on to that second block. And then once we've kind of now have that process of all the motor and movement happening, we can move to that more elaborate top of the triangle, which is going to be those advanced functions. So that's going to be speech and communication. That's going to be sensory and behavioral, emotional regulation. And that's going to be, as they grow older as a child, focus, memory, cognition. So again, we need the basics to hit that middle level to then hit the advanced functions. Each child is going to develop at their own pace 100%, but we want to make sure that they're moving through all of these. Now, it's really hard, when we have our CDC moving goalposts, saying, that speech isn't happening till a little bit later, or that crawling isn't a milestone. But this is scary to me because we can't eliminate some of these milestones or move the goalposts, because in checking for these milestones and these developmental markers, we can see those challenges early on. And we want to know, again, if something isn't functioning optimally right from when they're little, so that we can address it then, so that it doesn't become a challenge in that next level. Now, I know that as new moms, we have so many things that we're reading and watching and just trying to get a hold of how to do this whole baby thing. But I want to give you some things that I want you to watch closely for. So again, at around 1 month, we want a baby to be able to turn their head with ease to both sides. Okay, this is going to help with nursing, with latching, with swallowing, with reflux. We want to be able that they have that free range of turning their head both ways completely. I also want you to keep an eye that if you notice that your baby is always turning their head to one side, or if that they get stuck on that one side. So if they're always sleeping facing one way, or if in the car seat they always fall asleep with their head, tilted one side. You can also take note if they're maybe on the back of their head, if they're losing hair only on one side, or if they start to develop a flat spot. That's something that you should watch out for. Okay, we want a baby not to have that stiffness where their head and neck is super stiff. So oftentimes, new moms will think that their baby is just really, really strong. But again, at 1 month old, if they have that super stiff head and neck, that's actually a sign of tension in their system. Or if they're arching all the time or crying an excessive amount, these are things that you want to look out for. The last one, usually with a baby that's about 1 month old, is I want to make sure that they are pooping every day. So again, this sometimes is dismissed, but I always say if a baby is eating every day, they should be eliminating that waste every day, and they should be pooping every day. That goes for babies and kids and you yourself as well, right? If things go in, they do need to come out. At around 3 months old, the things that we want to keep an eye on are essentially still struggling to eat, so still having a hard time turning their head side to side, or if they're arching a lot, okay, those are concerns. We want at this point that tummy time is handled with ease, so that they don't get down there and after 10 seconds they're screaming to get up. We want them to be able to kind of be down there and look around easily, start to play with things. Those are signs that obviously the tummy time is developing easily and well. We want some smiling and interacting at this stage, and that they're starting to babble. Babies at 3 months should start using their hands and their eyes to coordinate. So again, either passing or, reaching for their feet. And again, we want them still pooping every day. So if they're not pooping, that is a concern, or if that they're frequently congested. Moving past that 3 month mark, things are developing at warp speed. And again, every baby is a little bit different, and they're constantly developing new neural pathways in their brain and their body and learning new skills all the time. But again, up until that 3 month mark, those are the key things that you want to be watching for. Now, looking at this big picture, again, to keep it nice and simple, the things that you are looking for are pretty much that just distressed baby, right? That baby that is super stiff and arch, if they're crying all the time, if they're banging their head, if they're just looking uncomfortable. These are signs that maybe you want to be evaluated by a pediatric chiropractor, and I'm happy to help anyone that's local. But if you also reach out to me, I will find you someone wonderful in your area. If your baby cannot stand tummy time, if they're really fussy as soon as you put them on your tummy, this is also a really big concern. And if they're unable to sit on their own or stand at 12 months, this again would be a good reason to have them assessed. If they skip crawling, I'll often see babies that go from that sitting and they're scooching on their bum and then they go right to standing. We want to make sure that they go through that crawling. That cross crawl pattern of learning to crawl is a really important developmental milestone that connects things in their brain with the opposite side of their body, so that moving forwards, they're able to walk and run and balance and even learn and hit all of those other different categories of milestones. So if they skip crawling altogether, or if they go through it really quickly, and then you find that they're all of a sudden just standing very stiff, that is a concern. If your baby is struggling with sleep, digestion, immune function, these are reasons that a pediatric chiropractor may be able to help you with an assessment. And if your baby just generally is spending lots of time crying or looking like they're in distress, these are good reasons. So I've shared with you a lot of the different things that you can be looking for in your infant and newborn and even moving forwards into toddlerhood. But how did we get here? A lot of times mom will ask me, why is this happening? Why am I seeing this? And we are definitely seeing it more and more in the office. And I'm going to nerd out on you here for just a moment to kind of teach you about how a whole baby develops and why this kind of gets stuck, or why babies have these challenges. So essentially, on the inside of your tiny little baby and you is this nervous system, which is your brain and your spinal cord and all the nerves that controls absolutely everything in your body. So this controls how your eyes blink, growing, movement, digestion, immune function, sleep, you name it. Now again, when this system is working perfectly, all of these milestones are hit with ease and we have a happy, healthy, thriving baby. If that system has a little bit of stress in it, then we can see some of these challenges. So again, I want to try and keep it simple, and I want you to think about it as being two parts. So when something in that spine isn't moving properly, we call it a subluxation. And in your world, I just want you to think that that means stuck. Okay. And when our body gets stuck, or when something's stuck, the first response of our nervous system is to kind of dive into this sympathetic state, or like a stress state. And a stress state in our body, even in a baby's body, means that muscles get tight, especially muscles in the head and neck and torso. And it means that they kind of get all wound up. Now you can imagine when a baby is wound up and when stress and stuckness get stuck in that area and sets up shop, we're going to see a huge impact on things like latching and nursing and tummy time and reflux and all of these important functions that have to happen right from the get-go. Now, where did this excess tension, or where is this stress coming from that is, getting these babies stuck? It essentially comes down to three things. So the first one is that, pregnancy has changed. So there are significant stress and emotional challenges for mom during preconception and pregnancy. If we think back to our grandmothers and how they gave birth, there wasn't the internet to look up everything that you were feeling. They didn't have the book, What to Expect When You're Expecting, which literally almost sets up every bad case scenario you can imagine. They had awesome support of their family. And if we think especially about the last couple of years, a lot of pregnant women didn't have their partners at appointments. They didn't have family that they could lean on, either before or immediately after birth. So again, there's more stress of that unknown. A lot more women are having fertility challenges because we are having babies later in life. These are all stressful situations that impact a mother's nervous system, which then also plays a role on a baby's nervous system in getting that stuck stress state. The second reason is a lot of babies are, just their presentation in utero. So a lot of breech presentations or cord wraps around the neck, or just altered presentation generally of your baby when they are still inside of you. And the third and the big factor is just the interventions at birth. So again, birth is very different than it looked like years and years ago. So we're having way more inductions and C-sections. We're also having a lot more physical assistance at birth. So vacuum, forceps, different things like that that are a physical stress on a tiny little newborn's system. So again, that physical stress at birth can create some of that subluxation or stuck process, especially in their head and neck, which is going to affect all those nerves that we talked about that are important of the muscles of their head, neck, and torso, affecting all those things that we've already shared today. So again, I believe that this is a huge area that has been dismissed as a reason that we're seeing more of the stress in babies. And the sooner we can recognize that and address it, the sooner that these babies are going to be thriving. So what can we do when you do see any of these concerns? And as a mom, again, just think simple. Start by getting your baby checked by a pediatric chiropractor. So in our office, that looks like an in-depth history, right? To find out about all the different stresses during pregnancy, what the birth looked like, how your baby was as a 1-month-old, 3-month-old, whatever stage you're at, to see if your baby is stuck in that stress state. We also have a special scanner that we use that kind of does a deep dive into see how their nervous system is functioning. So it's completely non-invasive. It's not like an x-ray. It's easy and it's safe and it's effective. And it gives us, again, a picture or numbers to put behind how much stress might be in that baby's system. And it helps us determine, recommendations for care moving forwards. So again, if I'm in your area and you have questions, please reach out, or I'm happy to direct you to a chiropractor in your area if that's something that you want to do. Now, I wanted to share with you a quick little story. Years ago, I had a woman in my office and her daughter had delivered, so she was now a grandmother, and this little baby was struggling with different milestones. And again, the pediatrician was just kind of passing it off as this baby had low tone. So at the time, the baby was unable to bear weight on her knees. She couldn't sit. She would cry if she was in either of those positions. She was about I think probably 9 or 10 months at this point. And she could only point with one hand. She hadn't developed her pincer grasp. Now, again, as I met this baby and we did this history, we found that there was other struggles in those various categories along the way. So there had been, stress in pregnancy. There had been intervention at birth. This baby was colicky and had struggled with some immune challenges and digestion. So again, all these pieces, remember, if they're not kind of laid as a foundation and a baby doesn't clear them or check the boxes, they can turn into those struggles in other areas as well. And so, at this stage of the game, we were seeing more of those motor challenges, and we could, by our scan and our assessment, we could see that this baby did have quite a bit of stress stuck in that neck area, which, like we've talked about already, is going to affect a whole bunch of those different functions. Now, as we started adjusting her, and again, pediatric chiropractic looks very different from what you maybe have experienced if you've gone to a chiropractor yourself, or if you've caught someone on TikTok or YouTube. For a baby, we use very, very gentle techniques. There's not the twisting or the cracking. We're going to use techniques that are safe, very gentle. Oftentimes, babies sleep right through it, but again, it gets the job done. And very quickly, we started to see this baby develop that pincer grasp, point with both hands. She could weight bear on her knees and sitting and then standing without crying. And at around 15 months, this baby was walking and has not turned back since. And so it's amazing, obviously, for me to see how all of these pieces come together. And it's very, very rewarding when I see them all of a sudden check those boxes so that they're thriving through life. And then I get to see a mom take that big breath of relief to see that their baby is thriving and happy and healthy. And so as I leave you, I just want to kind of say that, you need to trust your mom gut. So we're seeing so many increases in challenges in kids with immune function and autism and ADHD and anxiety. And we can't just sit back and hope that things are going to get better. So I want you to find a practitioner that is going to really listen to your concerns, that's going to ask you a lot of questions, that's going to dive deep into where these problems are coming from and to get to the root cause so that we can help your baby be happy and healthy moving forwards. Our world is not what it once was. Pregnancy is not the same as it was. Birth is not the same as it was. And our kids are living in a different world, right? They're full of physical stresses like screen time and sitting lots. Our products have lots more toxins in them. Our food isn't the same quality that it once was. So all of our bodies are receiving more stress from all different kinds of areas, and obviously that is causing our children to be a little more wound and tense and have that stress in their system, which then affects their development. So again, I want the best for you and for your babies, because kids are meant to live their best life. They are meant to be happy and healthy, and if there's anything I can do with answering your questions or guiding you in that direction, I would be happy to do that. If you have any concerns, please don't wait. Enjoy those babies. This time goes by so quickly, and please reach out if you have any concerns. Have a great day.